Smith. I'm from the University of Southern Mississippi. I'm your student nurse today, and I just came in to go ahead and give you a quick head-to-toe assessment and take a couple vital signs. It'll take about 10 minutes. Does that sound good for you? All right, I'm going to go ahead and perform my hand hygiene. And now I'm going to go ahead and check your wristband. And can you tell me your name and date of birth?
James Gunn, September 14th, 1989.
Okay, awesome. And can you tell me where you are today and what day it is today?
I came to the emergency department because of abdominal pain.
Okay, and then can you tell me what date it is?
It is November the 14th.
Okay, and can you take your nose and touch it to your nose? Okay, just based on talking with you, you're obviously reactive to what I'm saying. You can talk back, you know what day it is. So that would indicate to me that you're awake, alert, and oriented of your level of consciousness. And so on the Glasgow Coma Scale, that would be an indication of 15. That would be your score, which is the perfect score because you're awake, alert, and oriented. Also, when I walked in, I inspected that, you weren't flushed, sweaty, you didn't look like you were super pale, sick, and you also didn't look like you were cyanotic, had anything blue or jaundice or anything like that. You looked pretty healthy. And just so that's on my general inspection. So I'm going to go ahead and start our assessment, and I'm going to go ahead first to check your capillary refill on your hands, on your fingernails, and so I'm just going to press down right here, and I saw red come back after less than 4 seconds, so that is a normal indication. So that would mean that you get all of your, everything throughout your body is getting oxygen, you have normal blood flow, so that's good. And I'm going to go ahead and palpate your head and look right now to see if there's any lesions or masses, see if I can feel anything, see if there's any inflammation or hair loss. And it looks to me that everything is normal. You don't have any hair loss, any indication of lice or infection. And now when I also inspected your face, I noticed that you didn't have any lesions, any acne, you didn't have any drooping. Your head and your face is symmetrical. It didn't look like you had any surgeries on your face. And so now I'm going to go ahead and look in your ears, your nose, and your throat to see if I see any redness and see if that is normal. And your ears look good. They don't seem to be inflamed. I don't see any bugs or anything in there. I'm going to look in your nose. And then can you open your mouth and say, ah, for me? Okay, and it looks like that's intact, and you don't use anything, you don't use any dentures or braces or anything like that. Okay, and then now I'm going to go ahead and inspect your eyes. So Perla, that's what I'm going to be testing for, which means that your pupils are reactive. Pupils are equal, reactive, and accommodating to light, and that they have movement. So I'm going to go ahead and see if your pupils restrict or constrict. Okay, so it looks like they're equal, round, and reactive, and accommodating to light. And then now I'm going to test the movement of your eyes. And can you just watch from here? Okay, and that was normal. And then can you just watch the pin with your eyes without moving your head wherever it goes? Okay. Awesome. And then I also noticed, obviously, that you're able to respond back to me. It doesn't seem as if you have any hearing loss, but I'm going to do a quick test, and it's called the whisper test. And can you just let me know what I'm saying?
The dog is blue.
Okay. And so that means that your hearing is intact, so you don't have any hearing loss or anything like that. I'm going to go ahead and move to your neck, and I'm going to palpate your lymph nodes and your trachea to see if you have a deviated trachea or if your lymph nodes are swollen, which would indicate infection. And doesn't look like to me that they're swollen or you have a deviated trachea. It looks everything's normal. And then I'm also going to go ahead while I am right here, I'm just palpating your back to see if there's any crepitus. And I was also going to ask if you feel any pain, any joint pain, if you felt like you have any joint swelling or anything like that.
No.
Okay, and I'm just going to also feel your arms as well just to see. So, when I do that, you don't have any tenderness in your joints or anything like that?
No.
Okay. And then I'm also going to go ahead and take your temperature. Okay, your temperature is 98.8, which is normal. So that would indicate that you don't have a fever. And now I'm going to go ahead and move to listening to your respiratory sounds. I'm going to make sure that, I don't hear any wheezes, any stridor, anything like water or fluid that could be in your lungs. So I'm going to listen anteriorly and posteriorly, and then I am going to assess your respiratory rates. So usually when you do this, you're going to want to have bare skin so you don't hear any abnormal or false breath sounds that aren't there. Okay, can you take a deep breath for me? Okay. Okay, so when I listened to your breath sounds, I didn't hear any adventitious breath sounds, anything that would sound concerning. It sounds like your breaths were strong and everything looked to be normal. Your respiratory rate was also at about 15, so that's normal. You want it to be around 12 to 22. And so now we're going to go ahead and I'm going to assess your apical pulse, and I'm going to assess your peripheral pulses. I'm going to go ahead and do your peripheral pulses first. So we're going to do your radial and brachial on your arm, and you want to do it, check on both of the arms, not just one. So that would be your radial, and then we're going to check your brachial. Okay. And then we would just do your femoral on both, and then your popliteal on both, which is going to be behind the knee. And then you would also palpate the posterior tibialis on both of them, and then the dorsalis pedis on both of them. And so now I'm going to go ahead and assess your heart sounds, and we're going to go from your aortic to your pulmonic to the Erb's point to your tricuspid to the mitral, and then your apex and apical pulse is going to be right here on the mitral valve. And so we're going to go ahead and listen to those. And if we were testing and we wanted to listen to murmurs, I would be using the bell of the stethoscope, not the diaphragm. And your pulse is about 68 beats per minute, which is good. You want it to be around 60 to 100. And that also sounded strong, just like your respiratory sounds and your respiratory rate. It was strong. It didn't seem weak or didn't sound like anything was abnormal. And now I'm going to go ahead and I'm going to move on to your GI assessment. So if you could go ahead and lay down for me. And when I walked in, I assessed that your abdomen, You didn't have a distended abdomen. It didn't look rigid. You weren't in the guarding position or anything like that. So I'm going to go ahead and listen to your bowel sounds. Can you let me know when your last bowel movement was and if it was normal, brown, formed, soft?
It was about 6 hours ago. It was soft, brown.
Okay, and your bowel sounds sound normal. They weren't absent. Everything sounds good like that. And now I'm going to go ahead and palpate. I didn't palpate before because I didn't want to make it to be that there was any bowel sounds that weren't there. And I don't feel any masses. I don't see any lesions. Your stomach doesn't feel rigid or anything like that. That would be indicating a pathological process. And if you can go ahead and stand up for me, we're going to test your balance, your strength, and your range of motion. So can you push down on my hands? Okay, and then I'm going to push down on yours. Awesome. So it looks like your strength is intact and everything's good right there. And then I'm going to have you walk from here to here. And it looks like you're walking fine. Your balance is okay. It doesn't look like you have any assistive devices like a cane or a walker that you need help with. And then I'm also going to get you, can you do this with your arms just to test your range of motion and kind of twist just to see, and then, move your legs. So it looks like your legs and your balance and your gait and strength and everything like that is good. It doesn't look like you need any assistance or that your activities of daily living would be limited. So it looks like you're pretty healthy and normal and everything looks good. And I think that that's all today. And is there anything else that you have questions about, or is there anybody that you'd like me to go over this with?
Nothing I can think of.
Okay. Awesome. Thank you. I hope you have a good day.
Thanks.